Contemplating bariatric surgery has not been easy for Mark Rudd.
The decision is a very personal one for each of the patients.
Find out what types of bariatric surgery are available and the risks and advantages of each procedure.
Get as much information about each of those procedures as you can.
Teresa Leidy prepares as her day of surgery rapidly approaches.
I think I've prepared myself really well, especially cutting back eating. I'm not hitting the candy machine at work anymore.
See how life has changed for Nadine LeBlanc 2 weeks after bariatric surgery.
No more high blood pressure medicine, no more high cholesterol medicine.
Meet April Kohler, whose surgery 1.5 years ago has transformed her life.
And how much is your total weight loss?
106 pounds.
106 pounds. Wow.
And follow Judy Sims for a routine doctor's visit nearly 2 years after bariatric surgery.
So you lost over 20 BMI points.
Bariatric surgery. Transforming your health. Mark Rudd, an auto mechanic and a minister in a small town in Maryland, has been suffering from obesity for most of his life.
This is my wife, Teresa, and my daughter, Julia. I've always been a big person, as far as all my life. My mom always tells me when I was 6 months old, I was like 35, 40 pounds then, so I've always been a big person.
As a young man, Mark's height helped to hide his weight. After high school, he married.
Got married, had children, and weight started getting on me, and diets and stuff just wasn't working. So.
Now in his early 40s, his weight is a serious issue. But Mark is not alone in his suffering.
The prevalence of overweight and obesity is rising in this country. High-calorie, high-fat food is very easily available.
The food tastes really good, and it's relatively inexpensive, and it fills us. We know that there are some genetic predispositions. We know that obesity runs in families.
We've decreased our activity level, and we've increased our fat consumption and our carbohydrate consumption, so that we've been able to express those genetic patterns.
Mark's weight rose to 449 pounds with a body mass index of 50. His obesity had become morbid obesity, a life-threatening condition. Health problems related to his obesity have caused Mark to take action.
But the last couple of years has really brought the thought of and only being 41 years old, but death has really come to my mind more lately.
Morbid obesity is a condition of excess fat storage. It occurs when patients gain about 100 pounds over the ideal body weight. The problem with excess fat storage affects every organ system in the body. So there are over 35 different medical conditions that are directly related.
Some of these medical conditions called comorbidities include type 2 diabetes, high blood pressure, osteoarthritis, obstructive sleep apnea, heartburn, depression, infertility and menstrual irregularities, urinary stress incontinence, and high cholesterol. Mark suffers from many of these comorbid conditions.
Hiatal hernia, acid reflux, sleep apnea, high blood pressure. Things I've never had before, and all started creeping up on me.
He has a half-brother that died at 39 of a massive heart attack. His father had several heart attacks when he was 42. So, you're playing Russian roulette with your life.
As his health problems, known as comorbid conditions, worsened, Mark began to contemplate bariatric surgery.
Yeah, the decision to actually have bariatric surgery is a very personal one for each of the patients, and they have to decide if that is really the right thing for them.
My family is my everything, and that's the biggest fear in my life, is leaving them. I know everybody doesn't know their time or anything, but we don't need to rush it either.
Clearly, it's the only real long-term successful way of losing weight and maintaining that weight.
There is criteria for patient selection for bariatric surgery. They are not limited to, but they include having a body mass index of 40 or greater, having a body mass index of 35 to 40 with significant comorbidities.
It's a powerful tool, and that's the way we like to explain it to the patients.
Am I proud of him? I'm very proud of my dad. I saw him on the treadmill, looked at it, and he had walked over a mile, and that's when I knew he's really determined to have the surgery, and I'm very proud of him for wanting to add years to his life, because I don't know what our family would be like without him in it.
Many obesity-related health conditions may be dramatically improved or resolved with bariatric surgery.
The list of things that it helps is really long.
Some of the conditions that can be improved include type 2 diabetes, high blood pressure, osteoarthritis, obstructive sleep apnea, heartburn, infertility and menstrual dysfunction, urinary stress incontinence, and high cholesterol.
Bariatric surgery helps you by putting you in a better position to lose weight.
It doesn't suddenly mean that you are going to be able to eat normally and lose 100 pounds. You will lose 100 pounds, but only because you are helping the surgery.
Surgery is a big decision and certainly should be considered very seriously because there are risks involved in the surgery.
While Mark's condition makes him a good candidate for bariatric surgery, the decision is still difficult. Risks and complications of bariatric surgical procedures may include bleeding, complications due to anesthesia and medications, blood clots, dehiscence of the surgical wound, infections, leaks from staple lines, marginal ulcers, pulmonary problems, spleen injury, stenosis, and even death.
There are potential complications. We try to keep those to a minimum, that's for sure. But they should be understanding of the fact that that can happen.
With the circulation in my legs being poor and problems I have with my legs, I had a big fear of blood clots happening. And I found out about the filter that they put in that stops the blood clots and helps reduce the risk. So then I went ahead and pushed forward. And then my brother, he had it done. And he come through it great, successfully, doing great. He was my test subject.
Mark's brother Jack had bariatric surgery 3 months ago and has since lost 95 pounds. He's no longer worried about developing obesity-related health issues.
I'm only 46 years old, and I want to live. I want to be 66, and then I want to be 86. You know, I don't want to be remembered at 40-something years old dying.
No more buffet bars.
No.
That's for sure. Seeing the success that's in his life and things, so that has really pushed me to the point of saying that I need to do this.
Coming up next, Mark Rudd learns what types of bariatric surgeries are available.
Get as much information about each of those procedures as you can, and then discuss those in consultation with your surgeon.
Mark Rudd has decided to have bariatric surgery.
Hey, Mark. How you doing? Good. How are you? Good, good. I'm doing fine. So, you all ready? Yes.
When making the decision for surgery, it's important to learn about each procedure to determine with your doctor which may be best for you.
And I think the most important thing for a patient when you're trying to look at what procedure, because there is more than one procedure out there, is really to get as much information about each of those procedures as you can.